Hi, I'm Dr. Regan Tilley with WHOLEhealth MHK. Many of you already know me. Some of you may know of me, and some of you may not know me at all. So what I wanted to do was take a few minutes to come here and share with you on this webinar a little bit of education about who I am, what WHOLEhealth MHK is, and what our goals are for you. So first off, I want to thank you for taking the time to watch this little video for me. What it's going to do is take us into the next level of your care and kind of quantum leap you into the phase of wellness that you so desire. So first off, I want you to understand that we at WHOLEhealth MHK, Kate and I right now, and our team is growing, which is so exciting, believe that you should be in charge of your healthcare journey, not dictated by insurance companies and hospital systems or rushed 15-minute appointments. We believe in true health freedom. We believe that you have the right to have an impact and input in your healthcare, as well as a provider who will listen to you and understand where you're coming from. We want you to have true freedom, freedom to feel your best, to move your best, and to live with vitality on your own terms. Here's the reality. There is a quote from Medicare. This is a Medicare document, and this is why we don't bill insurance. It states, quote, care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. See the quote on our PowerPoint. I can't believe it. Let that sink in. It's really clarifying that the system isn't designed to keep you well. It's designed to catch you when you're already sick and keep you there. It's just not the way to go. At WHOLEhealth MHK, we flip that script. We believe prevention, vitality, and thriving are your true birthright. They are not luxuries. They are what you are here for, and it is what we are here to provide you with. Old medicine waits for you to get sick. We do things differently here. We get proactive. We partner with you before problems grow roots and get stuck in your system. We teach you, we walk with you. We empower you to take charge of your health journey every step of the way. It reminds me of this old truth. Tell me and I may remember. Show me and I will remember. Involve me and I will understand. At WHOLEhealth MHK, we involve you because real healing isn't done to you or for you. It's done by you. You are the master of your health, and you ultimately are your own best physician. And we're here to teach you and guide you in that. Most people are doing their best, even in healthcare systems. The doctors are doing what they know. My patients often come to me after having gone to their provider and asking for help and being told, well, this is just normal part of aging, or this is a part of menopause, or we don't do those tests because, you know, they're scientific or they're experimental and we don't know what to do with them anyway. So we're just not going to test for that. And so many people have tried on their own. They're piecing it together. They're kind of DIYing their health, and it is not effective because they don't know what to do with it. So many people come to me with piles of functional medicine tests and they say, my doctor doesn't know what to do with these. And I said, because they're not trained to know what to do with them. People bring me those tests and I look at it and it lays out a complete path for healing. And so I'm so thrilled when they have those tests. When you bring me those tests, it's wonderful because that lets me know you're invested in your health and that you're ready for change. You just need a guide. You need somebody who's walked that walk and can help you along the way. I want to give you just a short little history of me to let you know that I am qualified to walk that walk with you. So it's not just credentials and certifications. Yes, I'm a DO, which means I'm a doctor of osteopathic medicine. I'm certified in integrative medicine, and I am almost, except for the very last step, certified in with the integrative institute. We'll try that again. Institute for Functional Medicine. I have gone through all of their training. I have attended so many courses, and I've learned from so many of the masters in this field. And certification is one thing, it's great, but it doesn't mean that my brain works right or doesn't work right. What I know is the outcomes that I have with my patients, and my patients say that I help them. And so that's how I know we're doing it right. So that's just my training. Okay, that's my training. But I have walked this walk and I have gone through the dark night of the soul, if you will, when it comes to healthcare. I was hospitalized as a young child with a very bad sinus infection. And even the route that got me to medicine was that hard, scary experience. I was very sick. My mother didn't believe in medicine. She believed more in praying and hoping for the best. And there's a place for prayer. I'm all about that mind, body, spirit medicine that we do here. But I was too sick for just that. And the ER physician sat next to my gurney when he heard my mother come in yelling because my father and mother were divorced. And my father had taken me to the hospital because he saw how sick I was. And the ER physician quietly sat with me in that dimmed room and said, "Don't worry, I will protect you. I will keep you safe. She can't hurt you here." And that, in that very moment, was when I knew I wanted to be a doctor. So I could be that protector for patients, that I could be that intercessor to help them when the system wasn't helping them out and they desperately needed help. That's where I came into the knowledge of my purpose here on earth. Fast forward several years, I developed my own health issues because I was not fully guided and trained in my empathy, in my intuition, and in the knowledge that I have around medicine. And as I went through my 20s and went through a lot of those tumultuous years, I became sicker. I gained weight. I developed autoimmune disease. I ended up having a total of about 9 surgeries. So I have been through a lot. I have been paralyzed in my left leg once. I have been systemically paralyzed another time related to a flu vaccine injury and autoimmune attack. I have a diagnosis of lupus. I have a diagnosis of Hashimoto's thyroiditis and hypothyroidism. And I have a hormone imbalance related to all of the surgeries that I've had. So not only am I aware of these things, I'm walking the walk, not just talking the talk. So when you come to me and you have chronic pain, when you come to me and you can't sleep, when you come to me and you have weird skin issues and you have pain that's in your right finger one day and your left big toe the next day and your left knee, and it just migrates all over your body, conventional medicine misses that, or they call it arthritis. Well, that's not arthritis, that's inflammation. And I have understood that and learned that through my own experiences. So again, I don't want to take up too much of your time with that. And this is not meant to be a poor Regan. This is meant to be a example of a provider, of a doctor who has been there and experienced all of these things. And it makes me a better provider and guide for you. It makes me be more empathetic and understand where you're coming from because I've been in pain. I have been unable to sleep. I have had brain fog to the point that I thought I was going to have to quit my job as a physician because I was worried that my brain wasn't working right anymore. I have been to the edge and I am coming through that dark night of the soul because I have implemented all of the things that we do in functional medicine. This is a wonderful little segue into this. Again, most of us are doing our best. We're trying, we're going to doctors, we're taking a prescription or we're taking a supplement or we're listening to the thousands of influencers and which diet is best for them. Not necessarily you, but which one is best for them. And they think everybody should do it. Which exercise routine, how to go to sleep, what supplement to take, what bottle of water to drink, what collagen powder to take. So we're all trying our best. And there's a lot of noise out there. And what I'd like to do is bring you in and help quiet that noise so that you can get that true message from your higher self that you know what needs done, and we're going to help you do it. We're going to get to the root of your problems. We are going to help you prevent significant illness in your life as you age. So the ways that we bring it together is through nutrition. I truly believe food is medicine. And you have to know how to use it, and not one diet fits all. So that is the beauty of having a provider who understands that we can identify which diet will suit you best. And yes, there are foundational diets that everybody should benefit from, like an elimination diet or a detox plan. But what do we do next? That's where I help you through experience and through knowing what you're going through. The next thing is detox, clearing out what doesn't belong. It's just as important as adding in the things that you need, like supplements and the right food. We have to help your body clean house. Because if you can't clean house, it's like sweeping the dust under the rug or piling the boxes in the corner. It's not efficient, it's chaotic, and your body can't settle into calm. And most of us don't understand what calm is anymore. The next thing is hormones. Your hormones are the messengers of your body. When they're not balanced, everything is in chaos. When they are balanced, everything works better. And so we will determine if this can be done naturally or if you need extra support. And hormones aren't just estrogen and testosterone. It's cortisol, it's thyroid hormone, and multiple other neurotransmitters that sends those messages around your body. And that's where we work together to figure out where we need to balance for you. The next thing is fitness. It's not just exercise. Movement that builds strength, stability, and energy for your life is what we want to focus on. That can look like stretching. It can look like yoga. It can look like weightlifting. It can look like so many things, but movement. You know, the old phrase of Rolling Stone gathers no moss. I look at chronic disease like Alzheimer's, diabetes, heart disease, thyroid disease as moss. Those are the things that happen when you don't move. Another friend of mine put it so eloquently that movement is life. When you don't move, you die. And so this is where it's so important to figure out where we can get you moving, what kind of movement and fitness techniques work best for you, because it's not one size fits all. And lastly, it's mentoring. Healing isn't just physical, it's mental, emotional, and spiritual. And that is at the heart and the root of how I approach my patients. I think it's so important that we take into consideration that you are a whole person, that if we don't heal any spiritual wounds, if we don't work on your mental health, then your physical health will still not quite be up to par, because it's just lacking those two massively important areas of who you are as a person. So you will need somebody walking alongside of you, somebody who sees you. And that is what we specialize in here at Whole Health MHK. I've also brought in educators and coaches that we can have scheduled with you if you need that added support beyond what we're able to do on our weekly group calls and our scheduled one-on-one visits. These aren't luxuries. These are the missing pieces that conventional Western medicine doesn't provide for you. The system forgot. They just don't realize that you aren't an automaton that can take a 5-minute visit and turn it into a wellness routine. At Whole Health MHK, we bring all of this together for you and with you. You are part of the plan. So here we are, trying to wrap this up with some education as to why this is so important. If you're tired of feeling like a number or like you're only heard once you're already sick, it's time. It's time to claim your freedom. It's time to heal body, mind, and spirit. And it's time to do it together. If this sounds like something you want to know more about, I would really love to be able to have the opportunity to sit and discuss it with you. You can schedule a 15-minute discovery call with Kate or Jeff. You can call 785-775-1155 or look at our website for the discovery call link and get scheduled with them. We can schedule a practice member evaluation to see where we can work together to move you to that next level. Some of you are already members of my practice and want to do more. This is the way we're going to be able to rocket boost you into the next level of health optimization wellness. Some of you aren't members yet, or you used to be members and you just needed more. Well, I'm here to tell you, we've done an evaluation. We know how to do it better, and that's being implemented and it's in place, and we're ready to welcome you back with open arms, or to welcome you in with open arms. Some of you may be family members or friends of somebody who thought, you know, I think my sister or my friend or my brother or my mom could really do with this kind of help, and they've sent you this webinar. Again, I would love to have the opportunity to sit and talk with you and see how we can further improve your health, give you that roadmap, and decide together if this is the route you should take, or if there's a better route for you. So again, thank you for taking the time with me to listen, to hear my story, and let me tell you a little bit more about how we are here to serve you and the community as a whole. Thank you so very much. I hope you have a blessed day.